in Texas near San Antonio. Joining us now, previously scheduled but timely, for more on how to process this is Dr. Piedad Garcia, Deputy Director at the San Diego County Department of Mental Health. Thank you so much for your time today.
Thank you.
We're going to talk resources before this happened today, but I want to get right into it. If somebody's watching the news today, they're seeing this on Twitter and they're starting to feel overwhelmed, is there a resource in the community here that they could reach out to, can call to talk to somebody?
Absolutely. We have a 24-hour, 7-day per week access and crisis line here in San Diego that is staffed with licensed mental health clinicians that can talk with you, that are professionals that know how to deal with crisis situations and can refer you and link you to the appropriate services in the community if you need further assistance and support. So the access and crisis line is 888-724-7240, and they are available to answer and to support individuals that are impacted and affected by the latest tragedy that we have, or even if, aside from that, if they need mental health services or substance use services.
Which is where your role primarily serves. You have a big job taking care of people who are dealing with acute mental illness and with addiction. What are the things that we need to do and be aware of as a community to help people get into those services with the county?
Yeah, I think that there's an array of mental health issues or conditions that people experience and suffered. Depression and anxiety. There are other disorders or conditions such as schizophrenia or bipolar disorder, or traumas like the one that has been experienced today. And we have an array of mental health services, substance use services. We have psychiatric acute care beds, and I think the best way to connect with those services is through the access and crisis line, where they can interview you, screen you, and also ask you where you live, in what area, so you can be connected with the nearest program, mental health program or substance use program.
Connection is critical to getting well. Shared stories, shared experiences. You have the It's Up to Us campaign designed to empower San Diegans to talk about mental health issues. How important, I think a lot of people think they just need to get over things and they don't think they need to talk about it. When should people realize that maybe something in them isn't going right?
Well, I think that there are many signals, right? For children and youth, there are different signals, usually behavior issues at home or at school that are recurrent, that are not, the parent is not able to deal with at home, or that the school is telling you, the parent, that there's something different about this particular child. I think for adolescents and adults, there are symptoms of depression, symptoms of anxiety, inability to function at school, inability to function within the family milieu, or even with work. So those are signals, right? And aside from feeling sad, depressed, or nervous, or anxious, lack of sleep, not eating well, those are all signs. And so I think the main thing is, is it recurrent? Is it ongoing? How long has it been that you've been feeling this way? Weeks, months, days? Is it a reaction towards something that just happened, or is it something that is ongoing? So first thing is, you can consult with your primary care doctor. You can call the Access and Crisis line. They're all able to connect you to the existing services in the community once they screen for what's going on.
Dr. Piedad Garcia with the Deputy Director of Behavioral Health Services for San Diego for Adult and Adult System of Care. That number again is 888-724-7240. If people need help, if a loved one needs help, they should call that line.
Absolutely.
All right, thank you so much for your time today. May is Mental Health Awareness Month, and we're trying to help spread the word.
Indeed, thank you so much.